Hello everybody and welcome back to the channel. I'm Dustin and I'm here currently at the Gatwick Riverside Park in between Buffalo and Niagara Falls, New York. I had to come down to the States to come down for some Veterans Administration annual checkup, medical appointments, things like that. So I thought this would be a great opportunity to introduce the next topic and talking about healthcare and healthcare systems here as I stand in the good old US of A. We've got the red, white, and blue flying behind me. And as I cross this beautiful river, as I head back to Niagara Falls and beautiful sunset, the Niagara River, looking across to Canada as I head home to my current home away from home, and to discuss healthcare with you in Southeast Asia. Stay tuned. Lots and lots to think about, especially after doing the medical today. I was a bit surprised today, and one of the factors that I'm considering, why I'm considering this big move, is Western life stress. Today I was kind of astonished to see that when I went in for my checkup, my blood pressure was the highest that it's ever been. 148 over 86. I've never had blood pressure that high. The highest it's ever been in the past was probably 126 over 80, just barely outside of the normal range. So, doctor told me stress is a factor, and I know that. So that's a big factor into this decision. So let's talk healthcare. Let's look at healthcare options, costs, and everything in this episode of Should I Go or Stay? I just want to jump in here quick. I am still looking to connect with any existing expats in Southeast Asia. So if you're watching this and you would like to help myself and other potential expats learn from your experiences, share your story with us, I'm going to put my email, here's my email, and I'm going to put it in the description and pin it to the comments of this video. Let's connect and set up a time to chat. I would really appreciate it. Thank you. Picture a typical emergency in North America. It starts with an ambulance that alone can cost thousands. Once you arrive, you wait hours before seeing a doctor. A few stitches can be thousands of dollars, and an MRI $2,500 or more. Even with insurance, the bill can sting. Now, shift to Southeast Asia. In modern private hospitals, expats often take a rideshare for a few dollars. Inside, triage happens in minutes, and you might see a specialist within the hour. That same MRI is around $250, $400 in Bangkok, with results the same day. Prices are transparent. You get an estimate before treatment. Setting a broken arm might run $300 to $800. It's a stark contrast. But remember, we're talking about private care, which most expats use. Public hospitals are cheaper but can be slower, with potential language barriers. So, healthcare's cheaper, but is it any good? In major cities like Bangkok, Kuala Lumpur, Ho Chi Minh City, and Manila, private hospitals can rival or surpass Western standards. Many look like luxury hotels, marble lobbies, concierge staff, and multilingual teams. Behind the style is substance, robotic surgery systems, rapid diagnostic labs, and imaging tech equal to anything in North America. Doctors often train in the US, Europe, or Australia, and many top hospitals hold Joint Commission international accreditation to the global gold standard for patient safety. But step outside the cities, and things change fast. Rural clinics can be basic, sometimes a single nurse, with limited drugs and no x-ray or lab. In an emergency, reaching a city hospital might take hours. So, incredible care exists, but it's clustered where the population is. When it comes to health care, the quality of a doctor is only half the story. The other, equally critical part, is how long it takes to actually see them. Access and wait times are a major battleground, and the differences between North America and Southeast Asia can be staggering. This isn't just about convenience, it's about getting timely answers, reducing anxiety, and starting treatment sooner. In Canada's single-payer system, your family doctor acts as a gatekeeper. If you need a specialist, you can't just book an appointment. Your GP must refer you, and that's when the waiting begins. The system prioritizes urgent cases, but for anything deemed non-urgent, the wait can be agonizing. We're talking weeks, often months, and sometimes over a year for an initial consultation. This delay extends to diagnostics. Need an MRI to figure out what's wrong? You could be waiting for months, all while dealing with uncertainty. This prolonged waiting period is a well-documented source of stress for many Canadians. In the United States, the story is one of variability. If you live in a major city with a top-tier insurance plan, you might get fast access to specialists. But for many, it's a maze of insurance networks. Your plan dictates which doctors you can see without incurring massive costs. Going out of network can leave you with a bill for thousands of dollars. Even in-network, pre-authorizations for procedures create administrative hurdles and delays. And if you're in a rural area or have a more restrictive plan, your choices are limited, leading to significant waits or high costs. This is where private healthcare in Southeast Asia presents a completely different paradigm for expats. The experience is about immediate action. Forget the gatekeeper model. You can often go directly to a top private hospital and ask to see a specialist that very day. Many hospitals have websites or mobile apps where you can book an appointment for the same or next day. The process is streamlined for efficiency. You can see a specialist, get blood tests, have a diagnostic scan like an MRI, receive the results, and pick up your prescription from the in-house pharmacy all within a few hours, under one roof. For anyone accustomed to the protracted timelines in the West, this level of speed and integration is a complete game changer. Now, it's crucial to understand this speed applies to the private sector, which you'll likely use as an expat. These hospitals run like efficient businesses. This exists alongside public systems, which serve the majority of the local population and can be overburdened with long waits. This creates a stark two-tier reality, ethically complex, but for the individual expat a practical solution. And the cost for this convenience is remarkably affordable compared to US out-of-pocket prices. A specialist consultation might cost between $40 and $80 US. This accessibility also makes preventative care like annual health checkups an easy and affordable reality. Ultimately, when you choose healthcare in this region, immediate access is a core part of the value you're really buying. Rule number 1, get good health insurance. Do not move abroad without it. Healthcare is cheaper, but ICU or trauma can still cost tens of thousands. You don't want to crowdfund care. Insurance is your lifeline. Choose expat specific plans. Look for high limits, pre-existing coverage, and medical evacuation. Medevac can be the difference maker. Read the fine print, understand deductibles, don't buy the cheapest. Research JCI accredited hospitals and save contacts in your phone. Confirm in-network options. Have a plan before you need it. Carry your info. Use a medical alert if needed in local language. Find a local GP for routine care and navigation. A little preparation goes a long way. Preparation turns uncertainty into confidence. In the West, pharmacies are highly regulated. Most meds need a prescription, insurance handles the bill. Without insurance, prices can be brutal. In SEA, pharmacies feel more retail. Many meds are available over the counter. Helpful advice exists, but you must know what you need. Beware counterfeit or expired meds. Buy from reputable chains. Don't self-prescribe antibiotics. Bring your current bottle to match local generics. Know the generic name, not just the brand. Controlled meds still require local scripts and follow-up. Consult a physician for chronic conditions, even if OTC is possible. No one wants it, but ER trips happen. In the US, emergency care is excellent, but costs can create a second crisis. In Canada, the bill fear is gone, but waits can be long. If it isn't life-threatening, be ready to wait. SEA private ERs can feel shockingly efficient. Fast triage and rapid diagnostics. With insurance, the experience is far less stressful. Public ERs can be crowded, rural options limited. In remote areas, evacuation can be essential. Medical evacuation coverage is not optional if you live far from cities. Mental health differs profoundly between regions. In the West, access and acceptance are growing despite costs and waits. In SEA, stigma and limited resources can make care hard to find. Urban options exist, but are fewer and pricier. Many expats rely on online therapy. Plan for mental wellness as seriously as physical health. So as I'm filming this, I realize that there's so much more to healthcare in these areas that needs to be discovered. So I'm going to do a part 2 of this video so that we can discuss things like dental care, vision care, some paramedical like chiropractic services and things like that that are going to be important to myself and other potential expats. So make sure that you click and subscribe, like this video if you appreciate the content, and stay tuned for part 2 of this healthcare video. Thank you for watching, and I will see you on the flip side.